In this short practice, we are going to address pelvic pain. And we're going to look at pelvic pain through the lens of the possibility that tight hip muscles, particularly the hip rotator muscles, piriformis and gluteus medius and maximus, are contributing to a tight pelvic floor, particularly towards the back of the body. And the Pelvic Pain Foundation has come out with some wonderful stretches that are available in a handout in the portal. But there's also this fantastic sequence of stretches that we can do incorporating some of our traditional yoga postures and a few variations of those. So come to lying on the back with the legs outstretched. We're going to come and lie in supine position and allow the spine to settle. And just notice that the lower back is going to have a small space behind it so that you could slide the hand, the flat hand behind the lower back, or if you envisioned the gap behind the lower back, it would be about a ripe blueberry size. We're going to bring the right knee up towards the chest, Apanasana. Now with Apanasana, if we have knee problems, we would want to offer the choice of taking the clasp behind the thigh or on top of the knee if the knee's okay. And often with this posture, the emphasis is on the thigh towards the abdominal organs, and that will place pressure on the ascending colon. It will support the digestive process, and it's known as wind expeller pose for that reason. But for the purposes of pelvic pain, what we're going to tune into for these stretches are the bony points of the pelvis, the tailbone at the back, and the right sitting bone in this case. So we're really sending our mind's eye and our breath towards the tailbone and the right sitting bone, so that on our inhalation phase of the breath, we're creating a lovely sense of spaciousness and softening between the tailbone and the sitting bone. And on the exhale, we may even find that there's an increase in the distance between the tailbone and the right sitting bone. We want to hold the stretch for at least 5 breaths to allow the deep muscles of the pelvis to fully lengthen and soften. One more long, soft breath here, and then let's change sides, keeping in mind that blueberry-sized space at the back of the pelvis, which helps to keep the pelvis in a good sound position. And again, if we need to clasp behind the knee, if we have any knee issues, that can be really useful. This left side would generally target the descending colon as the thigh presses towards the abdominal organs. The descending colon gets a little bit of a massage. But for the purposes of pelvic pain, again, we're tuning into the left sitting bone and tailbone and the space between those two bony points, the lengthening in the deep muscles, the sensation of the breath reaching in to that area between left sitting bone and tailbone to create spaciousness, to allow for softening, to allow for lengthening of muscles that often get held so tightly in these places and cause a lot of issues with things like constipation, problems with general weight bearing. So often when these areas are tight, we'll weight bear towards the front of the hips, and it's a very it puts a lot of pressure on our hip joints and can often lead us to having hip issues. One more long, soft breath here, and then we'll change sides. Again, keeping that slight space behind the back. This time we're going to bring the right knee towards the chest, the left hand comes over to the outside of the right knee, and we're just drawing the right knee across the body and towards the left shoulder. So keep the upper body nice and long and soft. Keep the back of the neck long. Keep the slight space behind the lower back, and just notice the right sitting bone with this stretch across the midline, and how the right sitting bone just moves out and distracts out towards the side slightly, which is a lengthening, again, from the middle of the perineum or the perineal body to the right sitting bone. And that lengthening is really quite lovely. We can even take the right hand and place it on the right sitting bone and just gently draw the right hip out to the side even more to create spaciousness in that area. So we'll notice the right sitting bone really moving away from the tailbone and the left sitting bone. And if you're pregnant, this is still safe up until you're at around the 20-week mark, in which case you need to have a little bit of a wedge under the back, a little bit of a slant so that we're not lying completely flat. And then release after you've had a lovely chance to soften into the posture and change sides. So right hand onto our left knee, draw the left knee towards the right shoulder, and feel that left sitting bone just tip out towards the side there. And then if you feel to just gently increase the stretch while you're taking the 5 long breaths, remembering that small blueberry-sized shape behind the lower back, or space behind the lower back, we can take that left hand onto the sitting bone and just very gently draw the sitting bone out to the side as well. Taking deep breaths in to lengthen left sitting bone, away from right sitting bone, away from tailbone. And as we exhale, we're letting go of any tension, really noticing the softening, the melting, the letting go of the tensions that we so often hold deep in these muscles, and releasing. We're coming into the knees towards chest now. So we're going to take both knees in towards the chest to start with. Now we will lose that space behind the lower back because this one is a little bit of a pelvic tilt into the posterior tilt. And then we're going to stretch the right heel towards the ceiling, take hold of the little toe side of the right foot with the right hand, and just gently draw the right knee in towards the right armpit into a half happy baby pose here. And then we might like to take the left little toe side of the foot to draw the left knee in towards the armpit, and this becomes happy baby pose here, which lengthens the right sitting bone away from the left sitting bone. And we might also notice here that the pubic bone is being drawn away from the tailbone. So the whole perineal diamond shape is actually expanding in this pose. Now, this could be a problem if gravity and the organs were pressing towards the pelvic floor, but because we're in the inverted position, or where you know, gravity supporting the organs away from the pelvic floor, we're not putting the pelvic floor at risk of prolapse. And we're still getting that lovely stretch. And often prolapse pain will be there because gravity has pushed so much weight onto the organs, and happy baby pose becomes a way that we can soften into those muscles that have worked so hard against a prolapse all day. If we would like a variation on this and we're more comfortable with just one leg, we can release one leg and just lower the leg into the butterfly position, Baddha Konasana position on the opposite side. Sometimes that's more comfortable, and for some people, it's really just more comfortable to keep the left foot flat and left knee bent. And if we chose this more asymmetric version, we would want to change sides so that we can have a little stretch into the opposite side, if that's what we've chosen. And a good way to complete the happy baby stretches is to come back into a lovely reclined Baddha Konasana position. Now, if people don't have blocks, sometimes it's really comfortable to just place a fist under the lateral hips to give those hips a little bit of a cradle, to provide a little bit of support while we tune into the diamond shape of the perineum, and allow for the softening to occur. Allow for the lengthening between the left and right sitting bones to occur. Giving the pelvis and pelvic floor a chance to really utilize the effects of gravity, and also really give the opportunity for the softening process to facilitate the breath deep into the pelvic floor. We're staying here for 2 more long, soft breaths. And then we're just going to bring the knees back together, slide the right leg into extension, and bring the left knee up towards the chest slightly. Take the right hand onto the outer side of the left knee and very gently roll the left knee over to the right side, so that we can just come into a twist that really opens up the lower left quadrant of the lower back. It really gives an opportunity for the lateral band, the tensor fascia lata band of tissue that often gets very tight on the outer hips, to have a stretch. We're getting a stretch into the external rotators. And if we needed to, we could also pop a block underneath the left knee, or a hand if we prefer, or we can freestyle it. And we're again holding for 5 breaths. This is really awesome also for opening up the tight structures around the diaphragm on the left side, to create more spaciousness for the excursion of the diaphragm. Great if we have really tight oblique abdominal muscles as well, to get a lovely midline twist. And then we're coming back up, changing sides, sliding the left leg alongside the right one, bringing the left knee up this time, and gently drawing the right knee across the midline. And once again, if we needed to, we could prop with a block or a fist underneath the right knee. We're only coming across as far as we feel we can comfortably manage with a long, soft breath. We're opening up that right lower back quadrant here. All those tight tissues that will often result in a weight bearing that really emphasizes a level of increased weight bearing through the front of the hips, and there's a fast path to actually wearing hips down. Interestingly, some studies have shown that with some pelvic floor issues, as soon as someone has had a hip replacement, it actually completely resolves their pelvic floor issues, because often the muscles have been so tight in that area and so overworked. If there has been some cartilage breakdown, that the hip replacement resolves the pull that these muscles has on the pelvic floor. So we're coming back up again, and then just sliding your right leg alongside the left one, checking that you still have the gentle space behind the back, taking a moment to reset with some long soft breaths into the neutral position. And that's a beautiful sequence for supporting you to carry on with your day.